Okay, remember, prior to assembling any circuitry, it's very important to wash your hands with soap and water or use an alcohol-based hand sanitizer. And prior to attaching your circuitry to your client, you must have on gloves due to the possibility of contacting body fluids. Let's discuss the heated circuit. This is a heated circuit. We'll go over the parts. The best way to remember how to assemble a circuit and remember what the parts are is to start with the flow and follow it. The air comes out here of the vent and enters this biometric filter, which is designed to catch bacteria. This is called the dry side, and air comes down here and goes into the cascade where it's humidified. The humidified air comes up through the wet side, and in this wet side there is what's called a heating circuit or heating coil. This heating coil, the purpose of it is to maintain the humidified air in this humidified form and to prevent condensation. Condensation is the last thing we want because condensation in your line pooling breeds bacteria. The air comes up through to the Y, and this is where all of your readings are actually measured or initially sensed. These are transducer sense lines, and here in the Y are two little ports. It's very important not to place this upside down on your client, but to have the sense lines up. Otherwise, condensation can enter into the sense lines and will confuse the ventilator and cause dissense, alarms, and a lot of other problems. This is an extension tube for comfort along with the swivel. When your patient expirates, the air comes out, comes down through the exhalation tube and out of the exhalation valve. We like to call this the PEEP valve because this is where we control the PEEP, and we'll discuss that later. The tube comes out of here from the PEEP valve and comes around to your transducer. These sense lines come into the transducer. All of your exhalation values, like your PEEP, are read here. The other sense lines also come here, and they're read here at these transducer ports. It's a very good habit to prevent yourself from having to crank really, really hard and damage your fingers or hurt your fingers or possibly damage the plastic. This is plastic on metal, by counter-rotating your tubing and then allowing it to just sort of put itself on and just cinch it. This is all that's required. Counter-rotate about 1.5 to 2 turns. Place them on and cinch it with your finger. It's not necessary to crank really, really hard. Down here at the Fisher-Paykel are your thermocouple or your temperature probes. It plugs in here at the bottom port. And here, when the heated air or humidified and heated air initially comes out, there's a temperature probe here that measures the temperature. And then there's another one that measures the temperature just before it enters into your client's airway. This allows the Fisher-Paykel to better manage or control the heated wiring in here to keep the condensation out.